here's the general rule. So right now we're just going to look at concept, and I'm going to give you guys a concept, and I think it's 1 or 2 rules, and I'm going to make you go find a motion that increases it. All right, so what rule number 1 is wait, Blair, where did you say your issue was?
Left knee.
Okay, so here's what you're going to do, and here's what you need to know. There are 6 motions that you can move a joint. All right, so a lot of people, I'm going to use a neck because obviously you can see it the easiest right now. But if somebody said move your neck, most people would go, extension, flexion, all right, rotate, side bend, which those are your 6 directions. 1, 2, 3, 4, 5, 6. Okay. But what I want you to do is I want you to make those one-sided, which 2 of them are. I rotate to the right, I rotate to the left. I side bend to the right, I side bend to the left. So there's really 4 motions. I want you to make your motion so that, look, instead of flexing center, you'd actually flex to the right. You'd actually flex to the left. You'd actually extend to the right, and you'd actually extend to the left. Okay? I'm telling you this because those motions are what happen with every joint in your body. So what I want you to do is to find a motion that aggravates the area of your body that you want to deal with. Now, I'm going to give you an example real simple and easy, David, because sitting, everybody thinks, well, I'm just in a static position. But that static position is really a moment in time of some motion that's been stopped, and you're just hanging out there. And so you can really do forward to the right, where you can actually just do compression into the ribs to the flexion right, and then you can do the left. You can actually do an entire, where you go down and kiss your knee. It's more of a lumbar trunk motion, okay? And you can do an extension to the right, you can do extension to the left, you can side bend to the right, you can side bend to the left, and you can rotate right, rotate left. So my rule here is you're trying to find a motion that when you move towards it, there is one of them that is bad or uncomfortable, and the other one is fine. If both of them are yucky or uncomfortable, we don't want to use that motion. We want to find another one that has a good and a bad. And that's the most important concept right there. If I were to turn my head and I went, yuck, and I went here and I went, yuck, I don't want that motion. So I might then go, okay, well, let me go into flexion and see what happens. And I'm looking for one of those motions that actually has a good side and a bad side. If I go through all my neck motions and I don't really find much, it's because it's not coming from that area. And all we deal with is 3 areas: arms, trunk, and legs. Now you may say, but that has nothing to do with my neck. I understand, but we're going to show you as we go along. So right now, I want you to go find a motion that aggravates your symptom. And because there's only 2 of you, this will be easy if you all of a sudden say, well, I couldn't find much. I'm going to say to you, find one that aggravates it a little bit even, and I will help you make it worse. But if you can find something on a scale of, let's just say the pain scale of 1 to 10, and I'm going to make that pain scale a little bit different here in a minute, find something around a 4 or above, and if you can't, I'll help you find it. So go to town right now, put your camera back or put your camera up so that we can kind of see you, and get to work.
So can I do like a squat for my knee?
Yep.
That's typically what hurts then, like going up and down stairs.
And you may want to test in sitting, David. Doesn't mean it's test in standing. Test in standing. And if you find it there, that's fine too.
No, I was just thinking I'll probably find it more in sitting because sitting itself hurts. So,
okay. And
standing is usually better unless I do it for 20 minutes or something.
Right. And remember, David, you're compressing into extension. You're not leaning back.
Mm-hmm.
Okay? How you doing, Blair?
Of course, now that I'm trying to find it, it's
Okay, I'm going to tell you this.
hard.
Go lower and really squat into it. How you doing, David?
I'm still hunting.
Okay.
I will say that my left knee, along with my left great toe, has been a problem. So, like, if I try to do lunges with my patients,
Okay.
ooh, that hurt. I have a hard time rolling over my great toe even.
And do something that you roll over your great toe.
Well, like if I'm toeing off and I'm really trying to accentuate like a toe off in teaching gait, then that really hurts. If I push off.
Yeah, I'm not. The course is designed to make you so you can specifically get a aggravation no matter what you have. But I don't necessarily have time to do this short period of time.
Right.
But most people can find something. In other words, weight bear over that toe. Move the toe, move it up and over the toe. You know, when you weight bear, go a little bit more on the big toe versus on the pinkies and stuff, and see what you find. It's there. There is an aggravation motion. Now, David, you may actually get more aggravation if you were to go and lift your legs. In other words, stand up and do forward leg raise, do backward leg raise, do side out to the side leg raise, do a kick across like a soccer kick leg raise.
I think just doing like a single leg squat, that really hurts.
Okay. On a scale of 1 to 10, how much do you get it to aggravate?
Right now, when it kicks in, when I'm about halfway down, it's probably about a 6.
Good. Now compare that, because we're always comparing, like one's a gold standard. Compare it to the other side and say, oh yeah, there's definitely a 60% difference or a 40% difference or whatnot.
Yeah, I mean, my right's maybe a 1.
Okay, but remember the deal was, I want one to be good and one to be yucky. If you're telling me they both kind of bug you, we might have problems with that.
Okay.
David, how we doing?
I'm still having a hard time finding something that's real obvious.
Okay. Go down and do it.
I can do my right all day, and I mean, I'm not really feeling anything there.
Okay, good.
It's probably just more fatigue at this point.
Fair enough. All right, leave it. So you've got something you can play with. So just sit back down for a minute. Nothing, David?
Well, I sort of found forward bending to the right and to the left. I think the right is worse, like forward bending with some rotation to the right. That seems to give at least part of it.
Okay, and what did I say, though, about a motion that bugs you on both sides? Should we do it?
Yeah, I know.
So what you can do is say, okay, both of those bug me, and then we could go up to one that doesn't bug you much. But again, it doesn't have to cause pain, David. You might do it and say, oh my gosh, that side is a lot more stiff. Doesn't move as well as the other side. It doesn't have to bring on pain.
All right.
So during those motions you've tested, did you find anything that you said, oh my gosh, my right side doesn't work as good as my left, or vice versa? Now you keep doing the same motion, side bend, side bend, side bend, forward, forward. But you got leg pickups, you could do lunges. And this is what I find, is I go through with therapists and stuff, our ability to find motions that aggravate us, we are not very systematic. And I do begin to teach big time a very quick process to do that. And David, if you don't find anything, that's fine. We can still do something, and we'll watch Blair get better, and then I'll give you guys a little bit more direct motions to try.
I notice a little bit more when I do standing straight leg raise on the left.
Okay, and what number, 1 to 10?
Let's say it's at least a 4.
Okay, so David, I'm going to make that worse. I know you're on a smaller space there. So it's a 4 with a straight leg raise on the left, correct?
Yeah.
Okay, now I'm going to say to you, if you turn your foot in or out a little bit as you do it, does it make it worse? Now, you did it in standing, so you got to go back and do it in standing. Take the bad leg, see if doing in or out with the leg makes it worse. You did internal and external rotation of that leg.
Not appreciably, no.
Okay. But there is a difference between right side and left side, correct?
Yeah.
Okay. So sit back down for a second. Let me give you some feedback here. Blair, when you did yours, we named it a 6 out of 10.
Yeah.
All right, but we're going to name it from 1 to 100.
Okay.
Same kind of scale. 1 to 30 is a low amount, 40 to 60 is a medium amount, 70 to 100 is a high amount, except we're not just concerned about sensation, which is what we refer to as pain or tightness or whatnot. We want to know what's the range look like on that side versus the other side. What does the speed and the quality look like? And that we wrap together all in one number. This is what we found was missing out in therapy is we had this pain scale, right? But we didn't have this other scale. And this took us almost 4 or 5 years trying to, with our patients kept hounding us always about, well, that's no better, that's no better. And what they really meant, the pain sensation may not have been better, but there's 60 to more degrees in their motion. And what we'd find out is that they would say like this, they would go like this, they'd go, well, I was here, and I haven't been past there in 3 years, and it hurts me right here. I gotta switch back. And so they're like this, and it haven't hurt at all, and then all of a sudden, they get all the way up to here that they haven't been to in 3 years, and they go, I'm no better.
Yeah.
And they were dead serious. This happens all the time, even with therapists in my class. And I go, oh, we need to make this be a lot more specific in the sense of that number incorporates range of motion and everything. Because I'll take them back to here, and I go, do you hurt anymore? And they go, nope, not at all. And I go, oh, you're 100% better then, right? And they look at me and they go, oh, yeah, you're right. Are you hurting here? Nope. Hurt here? Nope. Hurt here? Yes. Okay, so when's the last time you moved beyond there? 3 years ago. So does that mean you're better? Yes. Okay, so what I want you to do, Dave, Blair, is to look at that again and pay attention. What I even instruct people to do is stop paying attention to the pain, okay, because we always focus on that's the easy one. But focus on the quality of motion, which is usually the speed. Anytime somebody's problem improves, speed gets a lot better, okay? So what I want you to do right this second, Blair, is go ahead and test yourself again on the thing that bugs you, and just pay attention to the other things. And again, you had said a 6, and we're going to still call it a 60, but I just want you to be aware of what it feels like. Got it?
Yeah, hold on, I gotta give a quick good night hug to my boys.
Exactly. What's that?
Sorry, boys are going to bed.
No problem. And now do the other side just to get a gold standard comparison. Now, David and I can see the difference even in the amount of you're going up and down in the screen.
I'm real ginger on the left because I know there are times where I just don't know if it's going to just give out on me, so I'm always a little bit slower.
Okay, you're making a rationale of why you're slower. You are just slower. Your mind is going, your body's saying, oh, I need to send these signals up to the brain to be cautious, which is exactly what we're representing. Yeah. You're putting a thought and a reason behind it. Maybe it's that way, maybe it's not. But honestly, what we see is just what you described. You're slower. You're not going as low. Would you agree, David?
Yeah.
Okay. And so now do the good side.
This is my good side.
Go.
I mean, I can go.
Yeah, I mean, your face disappears almost.
Well, also the quality is much better.
Yeah, absolutely. Okay, yeah. So it's easy to see this, and you know what? We don't ever use the words motor morons anymore. They'd never be able to tell because we show them. And we just discussed the 3 things, and all of a sudden, all these things that we used to talk about, oh, they'll never get it, my patients are too old, too this, too that. No, all we got to do is tell them those things and just have them compare. As long as they've got a motion that has a good side and a bad, they get the difference. If they got 2 that suck, they don't, and guess what? We're not trying to treat the 2 that, if right and left have a bad yuck, we just go to another motion. So, David, why don't we get you to come on up? And why don't you test that leg? your room's not big enough for us to really see it. So. Can you put it down a little bit? Do you have a laptop or are you doing the desktop? Yeah. Keep going, keep going, keep going. If you can. There you go. Now, kick up and let us see what you got. Which is your good, which is your bad?
My right is good, my left is bad.
Okay, go higher. Let us really get part of the game. Go even higher if you can. I want to really either present with something that... Good, now the other side. Okay, now we're seeing a little more something. Okay. What number would you give it?
It's actually less pain because I'm standing right now, but
Okay.
the interesting thing was when I was done and I sat down, my pain was worse, and it went down more distally than before. It's more pain in the groin and pain down, actually down to the foot, which wasn't happening when we were originally talking.
Okay, so we got to clarify this more. Go back up into standing, or we can do it in sitting. I don't really care. Is sitting? We can do that leg raise in sitting.
Let me see if it works in sitting.
Throw that camera down there.
Yeah.
Slide to the front of the chair and allow your body to lean back, but don't touch the back of the chair. Get away from the back of the chair, because then your body's becoming a chair. Slide to the front of the chair. All right. You're allowed to lean back, and I'd prefer you not even to have a back of the chair behind you, but you do, so you're allowed to lean back and stuff. Get it higher. That's just a knee bend. Lift your thigh up. That's what I'm talking about. Now let's do the other one. All right, so the speed and quality different. What number we got? 1 to 30?
I would say
a what?
On a scale of 100?
Yep.
I'd say 65.
Okay, good. And Blair, what are you going to give yourself?
On my bad side, I'd probably say, oh man, 100 is perfect.
No, 100 is horrible.
Oh, 100 is horrible.
100 is horrible.
Yeah.
I'd probably say like 85.
Okay. So high. What? So would you
I would
only
say
give yourself
35.
35?
100 is horrible. Oh, no, that's right. 100 is horrible. 65, right.
Is that what you would say? So 1 to 30 is a low amount of yuck or difference. A 40 to 60 is medium, and 70 to 100 is high. Where are you at, David?
Yeah, I'd say about 65.
Okay. And you can go ahead and put your camera back on you, more on your face. Okay. So here's what I'm going to give you guys now. It's very simple, but for some reason along the way, we've been guided and conditioned to be, we've been taught this way, is that let's say you're doing a joint mob, and I find out that you're restricted the most into an AP. Which way am I going to typically do or be taught how to do a joint mob now?
If you're not inflamed, to do an AP?
Correct.
Yeah.
Now, we do it, we're told to do it that way, and we say, there's the result. And either we have a result and we change and do something else. But the thing is, have you ever then decided, let's go PA, and let's see what the result of that is?
Sure.
Sure.
And you may say yes or no, but most of my students will say, that a teacher will go, no, I didn't really even think about that. And I said, well, in order to be scientific, in order to be evidence-based, you have to compare things, all right? So we have our own ability to have practice-based evidence in the sense of, okay, so I did a PA mode, it didn't work, now maybe I'll do an AP mode, all right? Now, which one works better? You got to decide, okay, let's go and do it. Now, somewhere along the line, somebody said to us, we could go and work the neck, maybe we could go work in the ribs a little bit, maybe we could go work down the elbow, who knows, if we're doing the shoulder. And we could determine which is working better, and then we could say, oh, see, the neck fixed it, therefore it was a neck problem, not a shoulder problem. right? And so we played that game a bunch, and we would test going one way that was most restricted, and that's direct access, you know, not direct access, but that's going into the direction of restriction. And then there's indirect, which is going away from it. Well, then we decided, well, what if we went left to right-sided? Okay, what if we then start testing the motion you can't do on the one side, we simply do the exact same thing on the other side. We're just curious. Right? And what you're going to experience right now is the result that we experienced, hopefully. And that's all you're going to do is you're going to go to the other side. You're going to do the exact same motion that you couldn't do on the one, and you're either going to do reps. So if I was doing arms and I could do this one, but I can't really do this one, all I can do is reps, a bunch of reps, like 20 of them. Or I can do pushing into end range, where I go up, 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 back, 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 up, up, up. And so I keep trying to go further and further for 20 seconds, 20, 30 seconds. But what we do is we do 2 sets of those, either reps or pushing into end range, and then we reassess the thing that we couldn't do and see if it's better. And the beauty of it, this is just motion testing, and we're going to find a good and a bad, and whatever's bad, we're going to treat with the good side on the other, the gold standard. Now, eventually you'll learn that you're a 3-dimensional creature, so the opposite of the right side is the left side, but the other opposite of top is bottom, and the other opposite of something over here, if I cut you diagonally, is the opposite hip. And that's simply the exact reason why a joint gets restricted or a joint's restricted. If you take a joint, it too has an X, Y, Z axis. Our body has an X, Y, Z axis, and our center core, or center of balance, or center of our joint, is right there at the center of, you know, what we call the center of balance and center of gravity. Okay? And if we were to extrapolate all this out in probably calculus and mathematics, we could find out where all the poles of the body are occurring. We call that the center core, and then we could actually find out that as you're having a problem and your shoulder's being pulled, it's actually pulling that center of gravity. We talk a lot more about this in the course and give you reasons why, and we give you the theory behind it. But the deal here is, let's see if that works. So what I want you to do, Blair, is I want you to just go do the good side. And why don't you do it for 15 to 20 reps. You don't have to kill yourself. If you need to use your arms on the good side, you can. David, you're going to go over and do a leg raise, either in sitting or standing, whichever one is more comfortable. Okay? And we're going to come back and retest in sitting. You probably should let's just do it in sitting on the good side. Okay. Cool? 2 sets of 15 to 20. Seeing you guys are doing reps. If you want to do pushes in the end range, you can. And then we'll make a determination on what to do afterwards. So those of you who will be watching this, I'm just filming a little bit of each one as we do it. And try to get into full motion. All right, so if that means that your belly's coming down as you do it a little bit, David, and it's coming down, I want that whole spring of the body to be happening. Blair, I want you going through as much full range as you can. It's really not about this effort. It's really about getting to end range. And if you have to help yourself get to end range and come back, and you need to use your hands or arms to do it, that's fine. But really get to that end range. Now, David, I'm not going to let you do that. Well, that's okay. Because if you had a shoulder problem, that might be problematic. Just kick it up. Use momentum a little bit right now instead. And then as you got used to that, then I might allow you to use your arms, unless, of course, it made it worse. And you don't. Yeah, there you go. Yeah,
how long you rest in between sets?
That's up to you. When you say, okay, that's good, you start up again. Obviously, the harder ones that you have, like David's or Blair's, are a little bit more weight-bearing. He's probably going to take more time. Yours is still hard being a leg raise, but.
So that's 2 sets.
All right, you got 2 sets, David. Give me a second. Yeah. Let's get David to get his done.
Okay.
And I like that, David. You're allowing your neck to come down. You're allowing your body to play into that motion. A lot of times people go, oh, you're compensating. You got to stay this way or that way. But just let your body do what it wants to and make it be as comfortable as you can. And then the next time we'll allow you to pull with your hands and see what it compares to not pulling with your hands.
Okay.
Okay, so Blair, retest your right side, your left side. It was your left side, right? And it was an 85. And now let's see what it is. Stop doing it. You don't want to keep repeating and doing 20 of them. You want to do 1 or 2, maybe most 3 to see what it compares to.
I'd say probably 50 now.
Good. Now, David, what did you notice about it when he was doing it? I mean, this time in comparison.
Actually, I wasn't looking at him, so.
You weren't. So this is what I noticed. You were faster. Now I would like to know whether you can go deeper. Can you go deeper, as low as you can on that side, just to let us see? Okay, back up. Good, that's okay. You're a lot lower, and you'll be able to watch the video again and see how much lower you are, which is good.
Yeah.
All right, now David, go back, put your camera down, and let's see your leg raise. And most of this is going to be, and you were a 65, we're heading to 0. Now, think about your motion, think about your range, think about the speed, and then think about the sensation.
Motion
57 would
feels
be a
better.
37.5.
Yeah, the motion definitely feels better. It feels close to what the other side is.
Okay.
It felt.
Bring up your screen. Bring up your screen, David.
It felt about as easy as the other side, and actually, it was less painful doing it. And right now, I'm actually having a little less pain just sitting here.
Awesome. So we'll call it a what?
I call it maybe like a 45.
Okay. All right. So if something works and it drops you, I guess it dropped you almost 40%, Blair, and yours dropped you just about the same, about 35%. What should we do now?
Mm-hmm. Do it again.
Exactly. And let's do it again the exact-ish same way. If you want to right now, try a little bit different where you pull with your arms. I'm not saying pull with your arms. You allow some weight to be, when you pull with your arms, you kind of, you're lifting still with your legs, but this prevents it from going back down. You can go ahead and do it that way.
Right.
Blair, if you're doing it and you want to push off of something, you can. You don't have to. My gray shorts kind of make me look like I'm in my underwear here, doesn't it? I just found a way to turn this. Uh-oh. Did I shut off, guys? Oh, no. Just for a second.
No, you're okay.
Okay.
All right, that's set one.
Okay. Go down low as you can, Blair. If you're not already, I can't tell you whether you are or not.
Yeah, I'm pretty low.
Okay. And I always say this, go to the motion that you want your other side to eventually look like.
Okay.
Go to the speed in which you want the other one to eventually look like. And again, don't ever hesitate to help yourself so you don't get exhausted.
Okay.
Go ahead and, all right, so actually, Put that back down and retest now for us, David. We'll do you first.
Oh, it's a lot higher.
It was a 45 that you called it. We're looking at motion, speed, and quality or sensation. What are we now? We're heading to 0. Don't keep doing it. That's good enough. Give me a number.
25.
25 is good. All right, Blair. Now, stop for a second there. David, what are you noticing?
Sorry, I wasn't looking at him. Do it again. Do it again, Blair.
What are you noticing?
Well, compared to the first time, he wasn't losing his balance as much.
And if you paid attention to where his head was in the picture, he is so much lower in the picture now, too.
Yeah.
These are great measurement tools. And Blair, you're a 50. What are you now?
Maybe 10.
Awesome. Now,
the pain sensation is not really there at all. It's more, I just feel like my balance and my speed maybe is just that last little bit that I feel like I'm missing.
beautiful. So what you can try to do now is pay attention to other areas as you do it, because we get focused in. You're paying attention probably, David, when you're doing it, to your leg, right? Lifting your leg. Maybe now pay attention to your belly as you do it and see what motion's happening there. Blair, as you're doing that, you may be paying attention to your knee, and I say, well, maybe pay attention to the way in which your shoulders, your arms are in space. It gives you something else to focus on away from that area. You don't have to do this. I'm just giving you something else because sometimes that gets us to go, okay, now I don't mind doing it as much. Now, you don't have to do as many reps. You can do whatever. You might want to do more. You may say, David, you're from 65 to 25. You're almost there. Blair, you're almost done with it too. Whatever you can do, because it's working, we want to keep doing it. In our seminars, we show you can do this in your mind's eye. You can sit there and imagine doing it and seeing it improve. All right. Right now, I'll keep you guys active by doing it. And again, Blair, if you're just like you're going, well, this is a lot of work, then maybe we could switch up. But I don't want to yet because you're young enough to do this. And I would just keep going the way you did, David. David, you're using your arms was so much more effective, it seemed like. Keep doing it. Make sure you pay attention to the top of your body. Not saying anything has to happen. I'm just saying be aware of another part of your body. Let's do 2 more sets and see where we're at.
All right.
So, Blair, I'm just going to give you some tips. Let's go all the way to the floor. We can even pause to the floor on this one. All the way to the floor. Now come back up. Not sure it'll be better. We're just compared to doing things. Just playing.
Can I do like pulses or?
I don't know. Yeah, if you want to do that, try it. That's fine. All we're doing, we compare the pulsing to not pulsing.
Right.
Again, don't hesitate to use your arms and to weight bear more on your arms to take some stuff off. Because you'll be sore tomorrow.
Yeah, thanks.
Hey, man, I've been trying to make it easier on you, but you just didn't want to. So.
You didn't tell me to bring a towel to this session.
Yes. Well, with what you're doing, yep.
I'm going to retest it now.
All right, so,
Okay?
yep. Was it 25? What is it now? What is it now, David?
It's pretty close to the same. Maybe a 20,
Okay, now it
a
can be
little bit
say
less.
25. Something that stays the same lets us know that something has to get tweaked. You got to change up a little something and all right? So there's
One of the
nothing wrong
things
with
that
it
I
staying
that
at
I
25.
now, one of the things that I noticed was that after I was sitting for a while, and actually I'm feeling it now, the pain starts rising more, at least in the groin area.
Okay.
It's not to the level it was originally. It's probably, a little bit more than a 25. It's probably getting back to a 40 or something like that. But it still feels a lot better. And I noticed the motion is still a lot better than it was when I started.
Do you have a higher chair? Do you have a
Actually
higher chair at your work?
a higher chair. I can
Yeah.
make this one higher.
Make it higher.
You think I can make it higher? Maybe not.
Make it lower.
Well, it's not cooperating. I can get a stool.
There you go. Blair, go ahead and test yourself. Nice. Okay, that's it.
Yeah.
You were at 10.
I think it feels just like, well, it's not as fatigued as my right, because my right's been doing all this rest, but other than that, it feels pretty good.
Excellent.
I mean, no pain. I feel like I can go down as quick. I
Excellent.
don't feel like I'm side to side. I'm going down pretty solid on it.
All right, David, come back to you.
Okay,
When you
I'm
sit,
on a
are you on a
lower.
stool? Are you on a stool now?
Yeah, it's lower.
It's less pain. Well, it's like
It is actually. It is actually a little less painful right now on the stool.
Okay. What's occurring, David? And this is something we call life skills and all. There's a reason people will say, "Oh, it's coming back," and then they won't take into association or into consideration their environment. And you've probably been sitting in that chair for 13 years, right? And that chair has become a height while you're trying to heal that's problematic. So if you said the stool still bugs you a little bit, I'd tell you to either go higher or go a little lower and see what it changes. All right? And so if you could put a book under it and stuff like that. Now, what ends up, people say, well, now my computer's too low, and I go, well, see if you can jack that up, because if you're being bothered, you're actually not healing in a state of being able to allow your body to heal.
Mm-hmm.
And because
Yeah,
you
I
have
think
to come, how's it feel now? In comparison to the last sitting position, which was just a minute ago.
So far a little bit better, but what happens is often it takes a little time to develop.
Right, and this is what I'm
Especially
trying to
once
say.
I unweight it.
Yes, you should notice that you have to wait longer because you said that, let's just talk about, forget about the pain, comfort-wise. Which is more comfortable, the chair right this second, the first stool height, or this stool height?
Right now it's this stool height.
Okay, so where we are, the more comfort we are, the longer it'll take to bring on the discomfort, or it may not come on at all. Now you may say, well, maybe I could go into something higher, and it's kind of just leaning on a thing with my butt could help more. But that's the deal, is that people say, well, I've got to wait here. You only have to wait here because you need to test seat heights to determine, oh, you know what? When I'm here, this is comfortable. Forget about maybe the pain will come back in 5 or 10 minutes, but just test your seat positions, and you go, this is more comfortable than that one and more comfortable than that one. This is the most comfortable I can get myself into, and that should help you tremendously.
Yeah. Well, what I notice is typically I'm better if I'm standing, but I just can't stand too long because I'm unweighting myself. And the higher whatever my seat is more comfortable because I'm not as loaded that way.
Again, and I'm going to say the same thing that Blair kind of rationalized why it was, and I only do it because we get into these reasons why things are. Well, they really are the way they are just because they are, and if you were able to change them, then as you heal, you won't notice them as much. Because you say, well, I'm weighted more, I'm weighted less, and I get totally what you mean. All right? But that could be the answer to your healing. That's all I'm trying to get at.
Oh, yeah, yeah.
All right, so with that said, you guys kind of get the whole picture of taking something that bugs you, taking it to the other side and seeing what happens. You got a little bit more tidbit. We call it life skills, but there's an entire unit about how to, there's an exact reason why something comes back on. We showed you a little bit with David. Now I want you guys to go find another motion in your body that's problematic. I'm going to tell you, you can test your arms, trunk, or legs. We only work in those three areas. We don't care what you come in with. We only test arms, trunk, legs. You come in with jaw problems, we test the same thing. Blair, you did weight-bearing legs. You can now try other weight-bearing legs or go up to the trunk and see whether you can find a discrepancy, some motion that feels different, right-sided versus left-sided. You can go over your arms. You can go over your arms and do the exact same thing. Now your arms have flowing forward, backward, side, side, but you can also weight bear, like where you do a push-up against a wall. You can do that forward, backward, side, side, rotate. Well, forward, backward, side, side. I'm not going to show you that instead. But go find another area of your body that's problematic. David, you might be able to find arms that are different when you do those.
I can find, there's a neck movement that is worse than the other, and there's also fingers that are worse than the other.
Cool, that's right. You had talked about the fingers. So go ahead and do your fingers for us and find the difference. Show it in front of your webcam when you find it.
Hey, Tom, I already know that my left wrist right there hurts, so I'm going to do push-ups.
Okay, so go do a push-up against the wall, but in a door frame. And then what I want you to do is to allow your body to go all the way through. So it's not about the weight-bearing part. You can put a leg in front of you if you want.
Okay.
I want to see what your shoulder and your chest complex is allowed to do on this side versus what it's allowed to do on this side. And pay attention to the motion of your spine and your wrist pain.
You want to see it, or do you just want to?
I would like.
Let me see if I can find a door frame that can. There's a door back.
A laptop or a desktop?
Desktop.
Okay.
I'm going to try the neck here. Can you see a difference?
Okay, so are you testing right now?
Yeah.
Okay, so are you feeling a difference?
Yeah, up here.
But one side's good, one side's bad?
Yeah.
Okay. Did you find something in your fingers?
Yeah. It's extension.
Extension?
Thumb extension.
Okay, don't do them at the same time, one at a time. This really drives people crazy when we. So that one hurts, the other one doesn't?
Well, this one is worse. This one I feel a little bit.
So you do feel a little bit.
Yeah.
Can you make your good side? Can you make your better side not feel it? In other words, by bending your elbow or anything like that. Because see, again, if both sides bug you, it's coming from an area that is not this one. Don't do them at the same time. One at a time. In other words, do one.
Yeah.
Sorry.
Problem is, I think I've injured both sides. But
I got you.
I injured the left side worse. I notice an obvious difference.
Okay.
Even abduction also. Maybe abduction's worse if I go further. Yeah.
Okay. So I'll give you two things. You can go ahead and try just doing a bunch of motions on the other what you consider your good side. And what'll happen if you weren't supposed to do your good side will be aggravated, and your bad side will be made worse too, perhaps. So big deal, right?
Yeah.
Blair, what'd you find out over there?
I don't feel it so much when I'm in a door frame. It's really the motion of extension and weight bearing. Like if I do this, I feel it a little bit, but if I'm actually doing weight bearing through my forearm, I can't. I'll collapse. It hurts so much.
Okay, so shut the door and do more weight bearing in standing, because a lot of times I don't want you to do full weight bearing yet.
Just one hand or both hands?
Just one, and make it hurt.
Is that how Rocky started?
If I kind of invert my hand and go down, I get more extension when I go into it. That hurts.
Try the other side.
What's that?
Try the other side.
Yeah, it doesn't hurt at all.
Okay. So what are we going to do to fix it?
2 sets of 15 reps on this side.
Or 15, 20. Now tell me the number that we're going to keep track of.
I'd probably say 75.
Okay. Now, David, we're going to keep track of, let's do your neck and your thumb, okay?
All right. I found something actually in my thumb. It's an even more painful spot on the same thumb. It's actually the
just show it. Put it in front of the webcam and show it. Can you do it without pulling it back? Well, we can try. That's so passive. I like active things. I like things that.
You like active range instead of passive?
Exactly.
All right. Well, I mean, I feel this a lot more than here. So it's a noticeable difference. I don't really feel much on the right at all right now, but right. I feel.
The only reason I'm doing this hasn't been done in any of the other 16 people. So if you fix your wrist or the thumbs, that'll be really cool.
Yeah.
All right. And so again, we could go and make you go in a doorway with your thumbs and push on it, and do the other one against the doorway or thumb, and you could really feel it and see what happens too. And you just go treat the good side. So go ahead. Let's just play around. Let's go ahead and do it.
Actually, right now I don't even feel it on the right side. I just feel it.
Go do it. Go do a bunch on the right side. I'd say 30, 40 of them because it's so easy. And that's good, Blair, because you're getting your whole body into it. You're going to find out that it's not just a wrist problem. And if I were to ask you to pay attention, you.
All right, so that's 2 sets, 20.
Retest. Was it 75? What is it now?
25.
Awesome. Keep going.
It's pretty amazing.
All right, so let's call yours a 50, David, in the beginning. What is it now?
Well, actually, I felt like it was more like an 80, and it's now more like a 50.
Okay, good. Keep going.
I'm getting hypnotized.
Yeah, I need to put you on screen so I can see the ding, 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 ding. What are those things called? The tempo?
A metronome.
Metronome, that's it. I love that word. So.
Keep perfect time.
And if we kind of start plateauing there, David, you could actually add resistance to it. Don't do it on this one, but on the next one we could add resistance at the end range and push against it. Blair, tell me when you're ready to retest, and we'll retest with you.
Okay. I'm ready.
Go ahead. You were at 25. Where are you now? That's it. That's enough. Stop.
Yeah. 5.
Okay.
It's really taking it. I mean, I
Come
don't
on
feel
back and sit on down over here. All right, David.
It's probably about the same, maybe a little bit less.
So why don't
Maybe
you
a
do it where you
45.
resist? Go ahead and resist it now. Just don't do it with a hurt thumb. Now you notice your thumb. Notice your hurt thumb is stuck up in the air, which it doesn't like. So can you put that down where it does like? There
Yeah.
So I'm making you do this because when I first learned this, my dad said to me, "So are you telling me if this thumb hurts, you can come over and treat this thumb?" Actually, it was his finger. His ring. He had hit it with a hammer or something. I go, "Do you have a problem with one of your fingers?" He goes, "I do. I can't bend this one down." I said, "All right, well, let's just check it out." And it worked, right? And I had another guy that was in. We were talking over the phone. Great guy by the name of Jerry Hatch. He does a pelvic course. And he goes, "Tom, I think I know what you mean." And he had 30 years where his one finger, I forget what it was, his one finger, if he went to torque it, would just kill him. And he couldn't torque and bend that thing. And so he went over to the other side, he torqued and bent, torqued and bent, torqued and bent, and he goes, "Tom, this is nuts. I've had this for 30 years, I haven't been able to straighten this out." And it changed. So I don't like treating things directly like that in this small area of the body because it really relates to other parts, but it's fun to see happen.
It's less.
All right, so what is it now?
I'd say probably about a 35.
Excellent. So again, you guys get the picture, right?
Mm-hmm.
So, Blair, what do you think?
I think it's amazing. I mean, my wrist really that started hurting way after I had first initially responded to you about these teaching sessions, and so it's been so dramatic of a pain over the last maybe week and a half that I've had to alter like my exercises in the mornings that I normally do. So like I said, I haven't been doing any push-ups at all, just because I just felt like that whole arm's just going to give way, and now I don't feel the pain at all with any kind of stress on that joint at all. This is pretty amazing. So, and I don't know what caused it to initially hurt, but it doesn't hurt now.
So where's this been?
It's a good question. I don't know.
I mean, it's not like I said. I've looked when this first occurred. I looked all over the internet, going, "Come on, I'm not that smart of a guy. There's got to be something going on here that something nobody's taught me or something." David, thoughts?
Well, I'm not sure, but I know that pain can cross, from one side of the body to the other from the same level. You can treat. One of the things that I teach, at least like in terms of electrotherapy, is particularly for people who have like CRPS or RSD types of problems where they don't tolerate any kind of provocation to the area that's painful, to treat the other side and the same area on the other side, and it helps. And there actually was a study that came out, and I don't remember the author right now. I can find it for you if you want, but where they actually demonstrated that. It was a clinical study, and so it may be because of how pain crosses. Somehow the wiring gets, it thinks that one side is actually the other. In more simplistic terms.
When I was in school, they said the same thing. Oh, somebody's really aggravated on one side, do some passive range of motion on the other, and then they'd be ready for it. Now they'll trust you, those kind of things. But nobody ever used it as a, wait a second, that may be what's the answer to solving this whole thing.
Right.
What kind of questions you guys got right now? I mean,
how is it for people with, more chronic problems? How helpful is it? And if it's helpful, how long does it take for people to, have no pain or be significantly, better?
Good question.
How much is the carryover? Because a lot of things can be helped, in one session. Is there, does it come back the next session? And
these are the kind of questions that anybody should have next. And I answer this two ways, and I'm asking this to you is a direct question. If you came in, if I came into you and you did a MOB on me, or you did a manip on you, you did a myofascial release on me, or you did muscle energy on me, how long will that last?
Well, you take a person through the active range when you're done, and you hopefully giving them some exercises to keep them in that pain-free range when they're all done.
How long will it last?
It lasts as long as the person's compliant.
It depends. Let's see how it is the next time you come in.
Exactly. It's going to last as long as it lasts,
Yeah.
right? And we say this, though. If somebody comes in and you are a mechanical therapist and you found that T1's torqued, T7 is torqued, and L3 is torqued, and they come to you with a shoulder problem, and they get rid of their issue by you fixing T1, is it more likely to stay gone longer with only T1 fixed, or is it more likely to get gone longer if T1 and T7 are fixed?
You're fixing multiple places.
And is it more likely to be even get gone longer if all three of them are fixed and put into balance? Which one's going to provide the longest amount of relief?
I think the more you address, right?
The more things we put back into balance, right? So when we have that question come up, again, if it's a therapist, I ask them about their own technique, okay? And they go, it makes sense. Or they say, oh, yeah, you're right. I don't know how long it's going to last either. And then I give them, okay, what if you have 3 imbalances and you fix only one? It's less likely to last as long. Doesn't mean it won't, but it's less likely. It's more likely to last longer if you fix 2 of those areas, and more likely if you fix 3. Here's the catcher, though. Who, when a patient comes in, and right now they have pain, and then you get rid of their pain by doing some manual therapy on them, but in 2 hours it comes back. Who now has the capability to fix themselves? The person that got it treated by the manual therapist or exercise-based therapist, or the person who did TMR and now can do the exact same thing to treat themselves?
Mm-hmm.
The person who taught to fish.
Right, and so the longest lasting thing is education, obviously. And again, I'm not being facetious here. I'm actually trying to lead the idea to the idea that, notice I called this a teachment session, not a treatment session. My job and my goal is to make it so that I can teach you and you're going to treat yourself. I haven't touched either of you guys. So your ability to make this last a long period of time is 2 or 3-fold. One is to find emotions that are out of balance, but don't just focus on the area. Know that there's 3 areas to focus on: arms, trunk, and legs. The more you can find out of balance and put back in balance, the longer it'll stay gone. And because you are given the control of this, the ability to assess and to treat, simple-wise, you now have the ability to either choose to do it or not choose to do it. And then what we do over a period of the TMR lessons is we show how to knock it down from something that takes you 20 minutes to be able to do and locate to being able to do 5 minutes and less.
So, Tom, are you saying that, like, for example, in my case, I had, a low back problem, a neck problem, and a thumb problem that we addressed right now, that had we not addressed the thumb problem, the back problem wouldn't stay better as long, or vice versa?
Ooh, that's a good question on that, because, okay, I'm not, ask me that question again, because I want to make sure I answered the question you're asking and not something that popped into my head about the question you're asking.
Okay, so, we treated 3 different areas on me.
Yes.
Had we not treated the thumb, let's say, would we expect the back to not stay as better or as better for longer, etc., would not be as good as it would have been or might be had we not treated the thumb? And the same thing for the thumb, had we not treated the back.
The only way we can determine that is to then tomorrow decide, I'm going to start with my thumbs right now and see if my thumbs actually make my back better and test it. In other words, testing the 3 things, like let's just say we test our whole body and then we take 3 things we're going to track. And we track those, and we can change orders and everything like that eventually. Maybe we find out that after doing that a week that we find out, the most beneficial one is the one in the middle, it's my trunk one.
Well, probably what would be best is if we could identify or determine how many painful areas there are first, and then say, okay, we're just going to do, 1 today and see how that goes, and then we'll do 2 tomorrow or whatever, because if we shoot the wad on all of them to start with, then we might, we've changed something, so we might not know what would have happened after that. I mean, you can look at it both ways from either perspective.
This is exactly what we did. When this first happened to me, it was a lady that couldn't take a step up a stair on her right side, and I sent her home only doing the left-sided stair because it worked so well. So I'll give you a little bit of a scenario of what happens from here. This is just coming in and showing you the concept. So you literally could go home and say, wow, it hurts me going up my steps on my right side. It doesn't hurt on my left. Oh, I know what to do. It's very, very generic and it's very broad. But what we then did is we said maybe there's X number of motions that have the most bang for the buck. And then so what we did is we put several people in a room and we said, let's kind of think about how many there are. And we didn't know how many there were. We said, okay, now go out and treat for a month. And then come back in now and tell us which is your top 12 exercises you did. And of the 3 or 4 of us that were in the room, we came down to 12 common exercises. We then took those 12, tested them for a month, and broke them down into 8. And then we did it for another month, and we broke it down into 5, and actually we added 1 back. And we now believe that if we set 100 people in the room to ask which are the most significant motions we could do, we probably all would say the same 6 that are what's called now the Fab 6. And then so when we come through, when a patient comes through, what we ask them, hey, can you find a motion that hurts your pain but doesn't hurt on the other side and feels bad on one, feels good on the other? And if they do, what happens is exactly what I'm seeing with you guys. Then the next step is we say, okay, now let's look at the whole body, and we test the 6 motions. And then we do that for 2 or 3 sessions. And they may find out that, number 3 exercise is my go-to exercise when I'm in pain. Then what we do is we take those 6 motions and we add 2 dimensions and 3 dimensions to them. Actually, we add 1 dimension, 2 dimensions, and 3 dimensions to them. And then they have a full-blown, with just these 6 exercises, what to do to get through an entire program of whatever pain they've got suffered with. And the thing
that's regardless of... It's regardless of where the pain is and what the pain is.
Regardless.
These exercises.
Regardless. So, for example, RSD, didn't know how to treat. That was one of my most frustrating diagnoses until we started doing this and treating the other stuff. And all of a sudden, RSD was just, it's not even a complex condition to me anymore. And you have to understand that we teach this and have people in every setting of physical therapy except for wound care. This is being taught in TMR TOTS, which is pediatrics. We're changing people that are supposed to be fitted for wheelchairs with cerebral palsy that are now out running again. Torticollis has changed. A lot of neat things. Again, it wasn't my focus because I'm an outpatient orthopedic guy. But as we began doing it on these brain trauma, stroke patients, you can get on the website right now and see a stroke patient change. Very fascinating stuff.